from Fort Lauderdale, Florida, and I'm 40 years old. My nose looks like a dinosaur head. It's got all these ridges and bumps. It looks exactly like the head of a brachiosaurus. I was a typical Midwestern outdoorsy kid, played softball, went camping, went boating, just lived outside. When we would travel a lot, my family would poke fun at me because I had a horrible snoring problem. Nobody wanted to share the room in the camper with me because they knew they were gonna be up all night listening to me snore like a trucker. So I decided to go see an ENT who suggested, well, why don't you just get a rhinoplasty? And I was like, well, wait, what? Is that an option? I can breathe and I can get rid of this gigantic triangle on my face. A few months after the surgery, I felt a really hard, pea-sized bump on the top of my nose. The doctor informed me he would be willing to fix it, no charge, if I were to not go under anesthesia. It was just unbearable. I was literally shaking and crying, and he was getting very annoyed that I couldn't sit still and I couldn't handle the pain. Then when he was actually filing the bone, it just sounded and felt just terrifying. I told the surgeon, I can't do this anymore, stop. I don't care what it cost. I will pay for the anesthesia. I cannot do this. After the procedure, the nightmare continued because we had just received the diagnosis from my son that he had Phelan-McDermid syndrome. Jack was the 227th person in the world ever diagnosed with this syndrome. It causes severe developmental delay and autism-like symptoms. They basically told us, your son's never going to go to college and he's not going to get married and he's going to live at home with you for the rest of his life. The nose was not something I could deal with at the time because my focus was on my family. Once we had a plan and we had a better routine in place, I decided to have the surgery done to have him fix the bump. But after about 6 months, the bump was still there, and I started to notice that the shape of the tip of my nose was changing. It seems like there's a battle between the skin and the cartilage, and I don't want to fear that my cartilage is gonna poke through my skin and I'm gonna have to have emergency surgery. I need some tea, I need some caffeine. We get to choose which tea we want, so that'll be fun to pick out which ones we like. My relationship with my daughter Stella is everything. She radiates positivity, and I think her life with Jack has forced her to step up, even at a young age. I finally have a doctor's appointment to get my nose looked at. I'm not gonna be able to just bounce back right away after surgery. It's not possible. And I hate to ask for all that help, but definitely can't do it on my own.
My mom has been through so much. I just want to help her no matter what. I mean, she's my mom. I love her. And I just feel like she definitely should get her nose fixed.
If Dr. Nassif and Dr. Dubrow can help you and you have surgery, when you wake up, I promise there will be a stuffed dinosaur in your arm when you wake up.
Jennifer had a few rhinoplasties. Look at her tip. Look at her tip cartilage.
Ooh.
That color doesn't look good.
That's the kind of tip where you could open the nose and just the act of opening it just to start the surgical dissection right in front of your eyes.
It starts to turn purple.
It could turn purple and turn black and die right there.
Please send in Jennifer.
Hi.
Jennifer, nice to meet you,
Nice to
Dr.
meet
Nassif.
you.
Hi, Jennifer. Terry Dubrow.
Nice to meet you.
Hi, I'm Jen's mom, Terry. It's a pleasure to meet you.
I love your
Meet
name.
Dr. Terry.
Yes, how about that? I think we spell
Terry
it a little
Dubrow.
differently, though.
T-R-I?
Yeah.
Exactly.
With a little heart over it?
Yes.
That's what he does when he writes me a little note.
No, I don't. But my friends would say Terry. They used to write and put a little heart over the I. I go, okay, funny,
know.
funny. But you have one R,
Very
right?
cool.
It's a tough name when you're a boy. It was tough growing up because normally when the name Terry is called in school, everybody turns and expects to see a girl, not this ravishing stud.
Well, thanks for coming in.
Thanks for having me.
So, take us back. Tell us why you got your rhinoplasty in the first place.
Okay. Well, I've always had really bad sinus problems. A lot of snoring, a lot of just drainage, a lot of problems, but it didn't go away. And the ENT did a physical examination, did a scoping and everything.
Yeah.
He's like, yeah, you got a pretty seriously deviated septum. ENT said, well, you can see a plastic surgeon. He basically was like, and they can, make it look better to cosmetically improve.
You didn't express an interest in having the cosmetic appearance changed to him?
No.
That doesn't make any sense to me. And instead of the ENT just fixing the sinus issues, he recommended that she see a plastic surgeon. Not cool.
So I went and saw the plastic surgeon and we did the rhinoplasty, and when it healed, I had this huge pea-sized hard bump right here.
What about your tip? The skin's very thin.
This is just kind of over the last probably 3 to 5 years, it's getting worse and worse and worse.
Okay, so that's called shrink wrappage, where the skin actually starts to shrink down on your cartilage.
You know, when you're the mom, you don't kind of pay attention. You know, it's your kid, they're beautiful. And even me, over the last year or two, was like, what's going on with her nose?
How is this affecting your daily lifestyle?
I do business development for a large construction firm in Miami.
So every time you meet a new person, you think, what are they
looking like?
thinking?
Someone did say something to me at an event. We were all making jokes, and I said, wow, that sucks. He goes, does it suck as bad as your bad nose job does? And I met this guy like an hour before. Totally.
What a pompous ass.
That is so mean.
Well, I think that we know why you want to have it done, obviously. Let's go to our exam room.
Okay.
Take off any makeup on your nose for me.
Okay.
Okay? Why don't we go
Sounds
do
like a
that?
plan. Hello again.
Hello.
Hello, young lady. Okay, so now I get a really good close-up look at that. Yeah, this is the edge of your nasal bones. You can feel it.
So
the edge of the
it's
bone, and
down.
then the cartilage just drops. Very thin skin. You can see every little outline of your cartilage.
Look at this irregularity right there.
Yeah.
Oh, it's see-through.
It's translucent. It's almost like a few cell layers thick.
Yeah.
Jennifer's nasal skin is extremely thin, and it's stuck to the cartilage underneath. And any irregularity, you'll see right through that one little cell layer of thickness of skin. It's almost like you've had about 9 or 10 rhinoplasties. That's how thin your skin is. That skin is stuck to the cartilage. The cartilage kind of fell in also and caved in, and that's why you're having this little irregularity.
The groove, right?
So basically, your tip cartilage has been overdone. So what does that mean with me opening it up? Worst case scenario, the skin can die.
Okay.
It can turn black and then die.
Yeah.
You okay?
Yeah, it's just a lot. It's just scary. It's a lot of bad news. Hearing the potential risks of black skin, dead skin are very, very terrifying. So the thought of those complications honestly takes my breath away.
I have to rebuild your whole tip. And even if it looks pretty damn good when it's swollen, this three-dimensional shrink wrappage, 1 year, 3 years, 5 years, 10 years, is gonna happen again. That's why we have to make sure the cartilage we put in is hopefully stable enough that it's not gonna warp like this.
Right.
What would you like to do?
If you think you can make it look better and you can help me, then I absolutely trust you to make it look better.
I wanna do it. I wanna help you. So I'm saying yes, I wanna do it.
When I'm saying yes.
I wanna try. You wanna do it?
Yes. I'm trying every day to live the best life I can and provide the best life for my son and for my daughter. When it comes to my nose, I'm gonna take the same approach. We're gonna go in, we're gonna attack it, and we're gonna do everything we can control and we can do to make it the best outcome we can.
Listen, it's a pleasure.
It's been a
We
pleasure.
look
Sorry,
forward
my
to seeing you.
sweaty.
Don't worry.
I was nervous.
It's good.
Pleasure.
Thank you so much. Thank you, guys.
Bye.
Woo. I'm
Okay.
overwhelmed. That's a lot. Oh, I have sweaty hands right now. Hands are sweating. Hi, I'm Jennifer. I'm checking in for surgery with Dr. Nassif. I'm ready to just have a more normal looking nose of the human variety, non-reptilian.
We're ready for you.
Okay, awesome. Sayonara.
We'll see you after
Thanks for
surgery.
bringing me.
What's hard about Jen's nose is that her skin is stuck to her cartilage. She's pinched on the 2 sides, and her tip just doesn't look good.
Ready for a nice old nap?
There's the good stuff.
So our goal now is to try to make her nose look more normal. For Jennifer's surgery, my team will start by harvesting rib and perichondrium while I open up her nose. I'll take down the bony irregularity on the right side and then reinforce and widen the bridge with spreader grafts, which will also give her a better airway and straighten her dorsum. Finally, I'll use my patented unicorn graft for added projection. Young ladies.
I would turn to look at you, but I don't want to hurt my torso. Hello. Good morning.
Hello. How are you?
Well, I look like I lost a fight. I don't think I look like I came out victorious.
So, you know, the first thing that I want to look at when I see you is the tip. Your nasal tip skin looks good.
Awesome.
So that right there is a win. That's like a huge win for me. Your nose looks fantastic. The grafts are in place. Your skin is spectacular. So overall, I'm very pleased. Other than that, Are you happy?
I'm happy that you're happy because I can't tell, but if you're happy, that means that I should be happy because you know what you did, you know what's going on in there. So I'm incredibly happy that you're happy.
Let's just kind of
I'm so
hang in there
excited. Yes.
and follow the instructions.
I'm in there. I'm in it. I'm in it to win it. Having another surgery was a huge risk for me. I was very concerned that something else would go wrong. So I am so thankful that all went well, and I wish I would have done it sooner, but this was the moment, this was the time, and I'm just incredibly happy.
What kind of ice cream are you gonna get?
Twist.
Me too.
Okay.
My mom has been so much more relaxed, and she's just really happy. She sees herself the way that I see her, just beautiful and strong.
I'm just kidding.
Hi! Oh, you look beautiful!
Thank you.
So how are you feeling?
I feel good. I feel like I don't have a deformity on my face anymore.
It's good that you finally took some time to do something for you.
I'd rather do something that is a little more relaxing than surgery. Next time, let's go on a vacation or let's go to the spa. Before my surgery, my dinosaur nose was the center of attention. But now, thanks to Dr. Nassif, the shape looks great. I no longer have cartilage hanging from my nose, and I'm no longer snoring. Now that everything's healed, we can laugh at the dino nose.
All right, take me for a ride.
Hold on tight, ladies.
We're going into the lake.